I will be discussing mainly 4 abstracts, 2 of them for patients with relapsed myeloma that have some novel combination for patients with relapsed myeloma after 1 to 3 lines of therapy, and the other 2 are for patients that have more advanced disease. The first abstract that I would like to highlight is a combination of carfilzomib, daratumumab, and dexamethasone for patients with relapsed myeloma that have failed 1 to 3 prior therapies. One of the highlights of this study is that they evaluated a particular population, and that is patients that are lenalidomide refractory, which is actually the majority of the patients nowadays that we treat in second line, as most of these patients are on maintenance Revlimid when they relapse. And these patients were carfilzomib naive. However, we still see very high response rates and also very good and deep responses. So obviously a good and important combination for this patient population. The study still has to mature. Overall the study treated 42 patients. It was a phase 1/2 study, so really in the expansion cohort there was a small number of patients, but so these still will need to be confirmed, but they're randomized studies that are going to be looking at this further. The second study I want to highlight is that another combination with carfilzomib using venetoclax and dexamethasone, also patients with early relapse. These patients also were naive to carfilzomib, but many of them were refractory to both proteasome inhibitor and IMiDs, and also very high response rates in the 80 to 90%. And definitely better responses and better depth of response in patients that express the translocation 1114. Third trial is a trial of an interesting drug that is called ruxolitinib, which is a drug that we don't use in myeloma. This is a drug that is a JAK2 inhibitor used in myeloproliferative disorder. But Dr. Berenson from California did a phase 1 trial combining this drug with lenalidomide and dexamethasone in patients that have failed more than 3 prior therapies, and they were all refractory to lenalidomide. And response rates overall were about 30%, and clinical benefit about 50%. It's an all oral combination, so convenient for these patients that are very heavily pretreated. And I think they did not see really any major toxicities. There were not DLTs. The MTD for len in this study was 10 milligrams, and for the JAK2 inhibitor, 50 milligrams twice a day. And lately, lastly, I guess, the CAR-T updated results. As you know, CAR-T has been approved for leukemia and for lymphoma. However, in myeloma, the studies are still ongoing, but they're very, very promising. The study that was updated was actually the BB2121. And this was a phase 1 study, and still was able to show more progression-free survival data. These were obviously very heavily pretreated patients, and majority of them had transplant. Majority of them were they all were exposed to a proteasome inhibitor and an IMiD, and a high percent of these patients were refractory. And still with this, we see response rates over 60, 70%, deep responses, complete remissions. All the patients that achieved complete remission that had MRD testing were negative for MRD. We were perhaps a little bit disappointed about the progression-free survival in this cohort, since progression-free survival, even for the patients that were MRD negative in the whole cohort, was about a year. So we probably were expecting more, but we have to consider that these are very heavily pretreated, and future studies are going to look at this treatment modality in early on in the disease, and in that setting we expect definitely better results.